we've done a lot about placenta. I have told you about the placental function, and now we are going to talk about the placental anomalies. This video is particularly important if you are appearing for your INI set, NEET or next exam, because there are a lot of images which might be asked, right? So in this video, I'm going to talk to you about circumfuriate placenta, placenta bilobata, placenta multilobata, placenta spuria, placenta membranacea, fenestrated placenta, circumvallate and circummarginate placenta, and towards the end, I'm going to talk to you about the placenta accreta spectrum. Right? So a very important video for all of you who are preparing for NEET, NEXT, FMGE or for INI set exams. Now, first about which we are going to talk is the abnormal lobes of the placenta. So what can happen is there are certain placentas in which a small part of the placenta separates from the main part. So over here you can see a small part of the placenta has separated from the main placenta, but it is connected to it with the help of blood vessels. So connecting blood vessels are still present, right? So if you have a small part of the placenta, a small lobe which separates from the main lobe, and remains connected to it with blood vessels. So with the help of blood vessels, it remains connected to it. Then such a kind of placenta is called as placenta circumfuriata or circumfuriate placenta. Right? So this image over here, what I have drawn is a circumfuriate placenta where a small part of the placenta has separated from the main part and it is still connected to it with the help of blood vessels. On the other hand, in image B, there are two equal lobes of the placenta which are separated from each other. So if there are two equal lobes which are separated from each other and the umbilical cord is coming and giving blood vessels to both of them. So umbilical cord is coming and it is giving blood vessels to both of them. Such a placenta is called as a placenta bilobata. Placenta bilobata. So the basic difference between two of them is in placenta circumfuriata, you will see a small part which is, which has separated from the main placenta, whereas in placenta bilobata, both the lobes, both the parts are going to be roughly of the same size. But the complications which either placenta circumfuriata or placenta bilobata cause are the same. So complications which they can lead to during pregnancy, both these types of placentas can lead to placenta previa and they can lead to vasa previa. What is vasa previa and how these can lead to vasa previa, I'll tell you shortly. Right? In the postpartum period, it could be, that the big part of the placenta, the bigger lobe comes out, but the small part remains inside. Now, the bigger lobe will be intact, right? So I will not even come to know that there is a small part inside. So in such cases, the small lobe which is going to be present inside, it is going to lead to postpartum hemorrhage. So in the postpartum period, it can lead to PPH, and if the small lobes remain inside, it can lead to infection. Right? So these are the complications which can be due to both placenta circumfuriata and placenta bilobata. So look at this image over here. In this image, what you are seeing? In this image, you are seeing that I have two parts of the placenta which are roughly of the same size, and I have a single umbilical cord which is sending blood vessels to both of them. Now, for all those who will be confused in placenta of twin pregnancy, you can say, ma'am, then how am I going to know that this is not a placenta of twin pregnancy? In placenta of twin pregnancy, you will get two umbilical cords, whereas here I'm getting a single umbilical cord which is sending vessels to both the lobes. This is what is placenta bilobata. Placenta bilobata is also called as placenta bipartite, or it is called as a placenta duplex. Right? Now, if the placenta has more than 2 lobes, so suppose instead of 2 lobes, there are 3 lobes or 4 lobes, then it will be called as placenta multilobata. Right? So this is a placenta bilobata, placenta bipartite, or placenta duplex. If there are more than 2 lobes, it will be a placenta multilobata. So this over here, what I have drawn is a placenta in twin pregnancy where each lobe or each placenta is going to have its own umbilical cord. Now look over here. In this image, what you are seeing? In this image, you are seeing that this is main part of the placenta. This is a smaller lobe which has disconnected from the main, and you can see the connecting blood vessels in between. I am erasing so that you can appreciate it clearly. So these are the connecting blood vessels. This over here is a single umbilical cord. So here, because a small part of the placenta has separated from the main placenta and is connected to it with the help of blood vessels, this is a placenta subcinturiata. Right? Now, I was telling you that whether it is placenta subcinturiata or whether it is placenta bilobata, both of them, they can lead to, vasa previa and placenta previa. So, how can subcinturiate lobe lead to placenta previa and vasa previa? See, placenta previa means if a part of the placenta, either the entire placenta or if a part of the placenta is in lower uterine segment. So it could be that the small part of the placenta is in lower uterine segment and the entire placenta is in upper uterine segment, right? Then also this will be called as placenta previa. Whether it is the entire placenta which is in the lower uterine segment or a part of the placenta which is in lower uterine segment, that is what is placenta previa. So obviously placenta subcinturiata, placenta bilobata, they can lead to placenta previa. In placenta previa, bleeding is going to be maternal. It's maternal bleeding which is going to happen in placenta previa. On the other hand, vasa previa is a condition where bleeding happens and that bleeding belongs to the fetus. How? So suppose if this over here is the uterus and this is placenta subcinturiata, this is the small lobe and this is the big lobe. Now both of them are away from the internal os. See, we say placenta previa is a condition when the placenta is either within 2 centimeters of the internal os, that is a low-lying placenta, or if the placental edge touches the internal os. Now, in this case, the placenta is neither within 2 centimeters of internal os, right, nor is the placenta touching the internal os. Right? So it is not a case of placenta previa. Now, in this case, suppose if the connecting blood vessels are lying over the internal os. Right? The blood vessels which are connecting the main lobe and the small lobe are lying over the internal os. Now, in this case, what is going to happen is that when this patient's membranes are going to rupture, or when, this patient is, the internal os is going to dilate. So, when the os is going to dilate, what is going to happen? There will be trauma to these blood vessels which are present immediately over the internal os. And these blood vessels, which are a part of the umbilical cord, they are going to get ruptured. Right? And all of you know that umbilical cord has got umbilical artery and umbilical vein, which is having fetal blood. So these vessels are actually the blood vessels of the cord. And cord has got umbilical artery and umbilical vein. So when this is going to rupture, it is going to lead to fetal blood loss. And whenever fetal blood loss happens, that is what is vasa previa. So have you understood what happens in placenta subcinturiata, how it can lead to vasa previa? If you are not understanding this diagram, I'll draw it again. So this over here is your upper uterine segment, right? So this is your main part of the placenta, this is the small lobe. And both of these are connected by blood vessels which are overlying the internal os. So this is not a case of placenta previa because both the lobes are lying in upper uterine segment. Now in this case, when bleeding is going to happen from the blood vessels which are present between the two lobes, and the blood vessels which are present between the two lobes, they are fetal blood vessels. Right? And because they are fetal blood vessels, they will carry fetal blood. And so when bleeding is going to happen, it will be fetal blood loss which is going to happen. And that is how it can lead to vasa previa. Placenta previa means a part of the placenta is in the lower uterine segment. So yes, succinturiate lobe can lead to placenta previa. It can lead to vasa previa. So is the case with placenta bilobata also. Placenta bilobata can lead to placenta previa, and placenta bilobata can lead to vasa previa also. Clear to all of you? There is one more condition which is called as placenta spuria. In placenta spuria, there is a part of the placenta which separates from the main part, but it is not connected with the help of any blood vessels. So a small part of the placenta separates from the main placenta and is not connected by any blood vessels. Right? That is what is placenta spuria. Now, image of placenta spuria is not available with me, and it's a very, very rare thing to get. So most of the times, if you are getting an image-based question, either you are going to get a placenta bilobata or a placenta succinturiata, unless and until it's a hand-drawn figure. Hand-drawn figure you can get of placenta spuria, but image of placenta spuria is rare to find and rare to get as well. Right? Then comes membranaceous placenta. As the name suggests, over here the placenta is very thin, and placenta is not limited to a part of the uterus, right? So over here the placenta and the chorionic villi are present throughout the uterus. So the placenta is present throughout the chorionic sac. Right? So what happens in membranaceous placenta? There is a thin placenta which covers the entire uterus or the entire chorionic sac. Right? This is what is membranaceous placenta. So the villi will be present all throughout the uterus. Occasionally, these villi may be deeply embedded, and then it may give rise to placenta accreta. So membranaceous placenta, that happens rarely, but it may happen that these villi, they go very deep and they may give rise to placenta accreta. What is placenta accreta? I'll tell you shortly. Similarly, if the membranaceous placenta is ring-shaped, if it is proper ring-shaped, right, then it is called as an annular placenta or a ring-shaped placenta. Now, what are the complications? The complications of a ring-shaped placenta or a membranaceous placenta is that it can lead to second trimester abortion. So this is a kind of placenta where the placental function will not be very much proper, and because the placental function will not be proper, so there will be decreased progesterone levels, and because of this decreased progesterone levels, there are increased chances of abortion, there are increased chances of preterm labor, right? Then there are increased chances of antepartum hemorrhage, and such a placenta is very difficult to remove completely, and because it is difficult to remove completely, it may lead to postpartum hemorrhage. Now, why it is leading to antepartum hemorrhage? Because it is covering the entire uterus. So if it is covering the entire uterus, it is also going to cover the lower uterine segment. And if it is going to cover the lower uterine segment, it is going to lead to placenta previa. In other words, it is going to lead to antepartum hemorrhage. So the complications which are associated with membranaceous placenta are because of decreased progesterone, there are increased chances of abortion, increased chances of preterm labor. Then there are chances of placenta previa, that is antepartum hemorrhage, and there are chances of postpartum hemorrhage. Also, If these villi are deeply embedded, it may give rise to placenta accreta. Clear to all of you? Okay. Then comes another condition which is called as fenestrated placenta. Now, in a fenestrated placenta, a part of the placenta, which may be a cotyledon also, is naturally absent. So, naturally you are getting a hole in the placenta. Right? So, a part of the placenta is naturally absent, and that is what is a fenestrated placenta. A fenestrated placenta generally doesn't lead to any complications. Right? Then comes extracorporeal placenta. Now, if you remember, when I was talking to you about the placenta, the fetal side of the placenta and the maternal side of the placenta. So, this over here is the fetal side of the placenta, right? And this over here is maternal side of the placenta, right? So, I told you the fetal side of the placenta, which is called as the chorionic plate, area-wise, it is equal to the maternal side of the placenta, which is called as the basal plate, right? Now, sometimes what happens is, sometimes the fetal side of the placenta, that is the chorionic plate, is small, right? And the maternal side of the placenta is big. In other words, the basal plate is big. Now, in these cases, what is going to happen? Because the fetal side of the placenta is small, this fetal side of the placenta is going to be surrounded by the maternal side of the placenta in the form of a ring. Right? And this is what is called as an extracorporeal placenta. Right? So, the basal plate is extra to the chorionic plate. So, there is an extracorporeal placenta. So, fetal side is small and it is surrounded by maternal side. Maternal side surrounds the fetal side in the form of a ring. Right? So, suppose this over here is the fetal side of the placenta and my this hand is the maternal side of the placenta. So, the fetal side of the placenta is small and is surrounded by the maternal side of the placenta in the form of a ring, and such a placenta is called as extracorporeal placenta. Right? Now, extracorporeal placenta, it can be of two types. In one situation, it could be that the basal plate is bigger than the chorionic plate. And why is basal plate bigger than the chorionic plate? Because of fibrin and clots. So there is swelling of the basal plate, and this swelling of the basal plate is happening because of fibrin and because of clotting. And that is why the basal plate is bigger and the fetal plate is smaller, the chorionic plate is smaller, the basal plate is bigger. And so the basal plate is surrounding the chorionic plate in the form of a ring, and the transition between the basal plate and chorionic plate is smooth. Right? So the transition between basal plate and chorionic plate is smooth. So basal plate is surrounding the the chorionic plate in the form of a ring, but the transition between them is very smooth. Right? Such a placenta is called as a circummarginate placenta. A circummarginate placenta. I am writing this again for you because otherwise you will write in the comments that ma'am, your handwriting was bad. So I am writing this again. The transition between basal plate and chorionic plate is smooth. Right? And the basal plate is big. Why? It is big because of fibrin and clots. Such a placenta is called as a circummarginate placenta. On the other hand, you have a case where the basal plate is bigger. And why is the basal plate bigger? It is because the membranes, the amnions and the chorion, they form extra curves or extra folds. So because amnion and chorion are forming extra curves or extra folds, that is why basal plate is bigger. And in such a case, you are going to get the amnion and chorion folded. So between the basal plate and between the chorionic plate, you are going to see a valve-like structure, valve-like folding of amnion and chorion. Valve-like folding of amnion and chorion. Right? And if you are getting between the fetal plate, that is between chorionic plate and between basal plate, if you are getting a valve-like folding, then that is your circumvallate placenta. Circumvallate placenta. So V for valve and V for circumvallate, right? So over here, between basal plate and chorionic plate, here also, basal plate is surrounding the chorionic plate in the form of a ring, but then between chorionic plate and basal plate, you are getting valve-like folding of amnion and chorion. And fetal blood vessels, they will be seen only up till this valve-like folding. They are not going to extend beyond the chorionic plate. So fetal blood vessels will not extend beyond the chorionic plate, and beyond the chorionic plate there will be valve-like folding of amnion and chorion, and then you are going to get the basal plate. Such a placenta is called as circumvallate placenta, right? So look at this image over here. Now in this image, this over here is the fetal side of the placenta. Right? You can see the blood vessels as well. Now, then you are seeing over here, this is the maternal side of the placenta. The thick line which I have drawn, this is the basal plate. Now, in between the two, can you see this valve-like folding? This valve-like folding? Right? So this valve-like folding which is present, these are the amnion and chorion, and this is why it is a circumvallate placenta. I am erasing it so that you can see this valve-like folding properly. I have marked the arrow on the valve-like folding. Right? And can you see that the fetal blood vessels are restricted to the chorionic plate? So this over here, I'm just marking it with a different color. I'm marking chorionic plate with a different color. This orange colored is the chorionic plate. The line where I've drawn orange color, right? The orange color arrow is pointing towards chorionic plate. Now, what are the complications of extracorporeal placenta? Extracorporeal placenta, it can lead to antepartum hemorrhage. It can lead to preterm labor, and because over here the chorionic plate is smaller. Now, because the fetal side is smaller, less blood is going to go to the fetus, so it can lead to fetal growth restriction, right? Now, these complications, they can be seen in any of the extracorporeal placenta. So, fetal growth restriction can be seen with circumvallate and circummarginate. Preterm labor can be seen with it, and antepartum hemorrhage can be seen with it. But again, they are more commonly associated with circumvallate placenta than with circummarginate placenta, right? Now look at this image over here. Now in this image, what you are getting? In this image, you are seeing that this over here is the basal plate. This over here is the chorionic plate. And there is no valve-like thickening which is present between them. So this is a case of circummarginate placenta. Now sometimes you people get confused between a circummarginate and circumvallate, because over here you can say that, ma'am, this pale area which is present on this side, it is appearing like a valve. to you it may appear like a valve. Now understand, please bachon, that if you are seeing over here, now in case of circumvallate placenta, the fetal side will be at a little depressed level. The level of the fetal side will be lower than the maternal side because the valve-like thickening is going to make the maternal side a little higher up. So over here, see the level here and see the level here. Now you can see that the fetal side or the chorionic plate is slightly depressed at a lower level in comparison to the basal plate. Now compare it with this image over here. Over here, they are at the same level. There is no depression, right? So if there is no depression and fetal side and maternal side are roughly at the same level, then this is what is a circummarginate placenta, right? So this image over here is a circummarginate placenta where you are not getting any valve-like thickening between the maternal plate, the basal plate, and between the chorionic plate.